in this world, we have good people, we have bad people. How would you give advice to someone that you think maybe someone is taking you for a ride with, they're coming up with something that isn't the right thing to do? What would make you suspect that this person is just taking the parents' money and not doing anything more?
I think that
we're not talking about you.
No. It's possible, and
I must hard you to believe because you're a virgin.
I have some cases in which some person was making intensive therapy to a children that have any possibility to be better. But it's very difficult for me to say the parent, this person is taking your money because it's so difficult. So in that part, I need to do the advice, like it's not my patients say stop intensive therapy, go for more conservative, or go. But it's very difficult in this world to deal with that because we don't have connection with.
And autistic kids,
it's difficult.
There are some doctors who make up therapies and take a lot of money from these parents. So they really should check with their pediatrician, conventional people, and see if there's any studies that back anybody, or they have put the real effort. It's not a one-on-one. In your case, you have one-to-many. But we're talking some situations, it's a doctor who makes outrageous statements with no backing. I even saw, I don't want to say where I saw it, they're taking a laser machine and putting it over a kid's head with autism and saying this laser will cure a kid of autism. I mean,
this is awful. This is
awful.
Terrible. Because what is the most easy person to trick parents with problems? They do anything for the children, and you can offer anything, and you can make money on that.
See, in your website, which I happen to like, you had case testimonials.
Absolutely.
Of legitimate cases.
It's there, and I can give the telephone and the address and everything.
One of my patients, the mother, is a speech pathologist, and she brings the kid to you. If anybody would know or smell something wrong if someone's in the business, unfortunately it seems if you're a cancer doctor, you'll get a kid with a cancer problem. It seems, I don't know why, God maybe says you can handle it, I don't know. And if you have a person who's expert in speech pathology and they get a kid like that, you always wonder why. But the point is, they would know who the experts are, and they bring their own kids to you. So if you check somebody out and you can't find legitimate references to that particular person, you can be a little bit careful because you're very vulnerable. If someone promised you 100% cure, you said 70, guaranteed perfect results, walk away. No one, nobody can guarantee. You can put improvements, and there are failures.
Exactly.
And that's.
Absolutely.
And there's no antibiotic that kills the bug 100% of the time, and there's no therapy that works 100% of the time. So if anybody says, I guarantee you, for $8,000 a year for 5 years, I'm going to cure your kid, the man will be going on a lot of nice vacations on you.
Well, if this is true, this person, whatever is 8,000 a month or a year or 10,000, if it's true, will get the Nobel Prize. Will be already known for all the world. So, it's not true. Nobody can guarantee to a developmental children with important diagnosis to do 100%. We try to compensate, we try to do the maximum that the brain allowed to us, and that's the truth. The rest is just manipulation.
It must bother you that you have that 30% you can't reach.
No, I'm very happy with the 70. Bother me inside, and I try, but I cannot be negative. And I sometimes to mention in my courses that 30% bothers me, but let me be positive and to be ready for tomorrow.
But the people involved in this talk to each other. Does anybody look at things even a little bit differently to see if there's something you can do to get even higher than 70%?
In my knowledge, no. In the related to my therapy, or no. People around the same statistic. I don't know. Look, I'm working for 37 years, for 12, 14 hours a day, so I have a lot of experience, and I don't hear about that. I don't hear about that because commonly some children came from already students and come to me and have a very good relation, giving counseling to the parents and treatment that come from, and I didn't hear honestly a statistic that is superior I can do. It's around similar with the good therapies that really invest time and effort to work. It's around the same, 70%.